Hi everyone. Today I thought that I should deal something good topic for the NCLEX RN. And I believe that most of the questions were for me it was asked from these topics. So the topic today we will discuss is respiratory tuberculosis. As we all know, we should refresh our memory that what is tuberculosis? Tuberculosis it is a bacterial infection. Remember, it is a bacterial infection which affects the lungs and it is caused by Mycobacterium tuberculosis. So the organism is Mycobacterium tuberculosis. It spreads through airborne route and once it's inhaled, it will enter the lungs and then it will spread to the lymph and then to the bloodstream. So remember, it is an airborne infection which is spread through the airborne route. And once we will inhale, it will enter into our lungs and then spread to the lymph and then to the bloodstream. Now the sign and symptoms, the key points that you should remember. Night sweats, anorexia, which is commonly known as weight loss in a layman term, and cough, hemoptysis, which is blood-tinged sputum, that is blood-tinged sputum. So this is a common questions that I asked, what type of sputum will be there. So you have to remember, hemoptysis is the common signs and symptoms in tuberculosis, dyspnea, and shortness of breath, fever and chills. So the memory tricks you can easily remember TB. So T for terrible cough, that is blood-stained sputum will be there. B for bad infection which result in fever and weight loss. Now coming to the diagnostic test. What are the diagnostic tests that will confirm that the patient is have tuberculosis? So first is intradermal injection. This is also known as Mantox test, and we have usually read in our olden times it is a PPD test also it is known as. Okay, so which requires a 24 to 22 hours of window for reading. If the duration, if the duration that you can see that will be a, if it's a positive there will be a raising up of the skin. So it is an intradermal test that is done, and if it is more than 15 mm of duration, that means the person is positive for tuberculosis. Then the next confirmation test is chest x-ray. You can't even confirm it with the intradermal injection. You have to do other tests also. So for that, chest x-ray. Then sputum cultures, which are the active forms of tests that are done. So the key points that you have to remember that when you are collecting the sputum for the patient, it should be in the early morning sputum and in a sterile specimen, and 3 consecutive days you have to collect the sputum. So remember, 3 consecutive days you have to collect the sputum. Then coming to the ETI, the precaution for a patient with suspected TB, the common thing that we are doing, airborne isolation. So as we know, it is a airborne infection. So we have to do the airborne isolation for the patient. First action for night sweats in the patient, weight loss, hemoptysis, fever and chill. So these are the common things that you should remember. And the action taken for all these things are you have to do the airborne precautions. That is airborne precautions. Now coming to a common, I thought I should uh, grab something from for you, that is a Kaplan question. If a client with comes with anorexia, low grade fever, night sweat and productive cough, what is the priority action we have to do? As we have studied, airborne isolation is the airborne precaution is the main thing that we have to do. That is our priority action. So if there is a question like that and in that one it is mentioned airborne, you have to prioritize that one. Then coming to the TB drugs. What are the TB drugs that are being used? So 5 TB tips that I would give you here is 5 NCLEX tips. That is, medications it should last 6 to 12 months. Then you have to wear the N95 all time. That is N95 mask. Every time we are carrying, we should wear the N95 mask. Family has to be tested for the tuberculosis. So if a person has been diagnosed as positive for TB, definitely we have to screen the family members also. Sputum culture, that is 2 to 4 weeks we have to test. Once it's confirmed, every 2 to 4 weeks we have to do the sputum culture to confirm the results. Then 3 negative cultures if taken, and on different days. If it's negative results, then the patient is no longer infected. Now, the memory trick to remember about the drugs of the TB are ripe. And remember, all these medications will lead to liver toxicity. So remember, all these medicines will lead to liver toxicity. So ripe means rifampicin or rifampin, I isoniazid, P pyrazinamide, and E ethambutol. So coming detail, what is rifampicin or radfampin it is also known as. So it is a something key points that you have to remember for rifampicin is if a person has been started with rifampicin, it's normal to see red color or orange color tears, urine and sweat. So don't be scared when you see a urine of orange color. It's a normal thing when you start with the patient for rifampicin. Instructions to wear glasses instead of contacts because the tears will be there will be discoloration in the tears. So we may be scared. So always ask the patient to wear glasses only, not the contact ones. So this is an NCLEX tip. For oral contraceptive infections, you always use the hormonal types, then safe methods for the birth control, and also monitor jaundice for these patients if the patient is being started with rifampicin. Now coming to the next drug, that is isoniazid. INH is also known as INH. So remember INH. So all the things will be dealing with this INH. I means it will interfere with the absorption of B6, that is paradoxine. So remember, our vitamin B6 will be affected if a person is taking isoniazid. So low vitamin B6 will be there, which will lead to peripheral neuropathy. Total vitamin B6 we have to take 25 to 50 mg per day. That is, we have to take at least 25 to 50 mg per day of vitamin B6 because there will be a less absorption of vitamin B6. Then neuropathy. If there is a neuropathy, you have to report. That means neuropathy means there will be some new numbness person will be feeling, there will be tingling of the extremities, ataxia will be there. Ataxia means there will be gait disturbance. So if such things are being observed, you have to report it immediately. Now, it Now come to the H, that is hepatotoxicity. If there is a person is having hepatotoxicity, that one has to be reported immediately because what are the signs you will see when a person is having hepatotoxicity? Jaundice, there is a yellow colored skin will be there, sclera will be yellow color, dark urine will be there. This is a common NCLEX tips that you have to remember. Fatigue, elevated liver enzymes, then in such scenarios, you have to hold the med and no alcohol for the person. Pyrazinamide, pyrazinamide, there is nothing much asked about pyrazinamide, but you should remember that when person is on pyrazinamide, there will be increased level of uric acid. Now dealing with the ethambutol, always remember it's related to the eye. The key point that you have to consider in this drug is report if there is any blurred vision, any color changes. These are the common things that are being asked in the NCLEX, and always teach a person to do the eye exams and routine eye follow-up also. Thank you everyone, and I think most of the things I was able to cover it, and I believe that it will be helpful for you. Kindly give me a comment if I have able to give you some information that I believe that whatever I have learned during my NCLEX exams, I have shared with you.